You go way too fast. Good evening. Welcome back to Boomer Rex Tonight, your nearly daily source for news and politics. Let me introduce Mr. Boomer Rex himself, who's back and not dead.
Yeah, right.
Yay.
Which I think is cool.
Yeah, we do too.
We were just gonna weaken a nitwit your ass.
Uh,
That's really why we're recording you. We're just getting enough to make a deep fake.
okay. It's like the one in Scotland where they took the dead guy to the post office to get his pension.
Look, there's some upsides to remote working. If you know a boomer that makes some money, they don't ever have to retire. It's fine.
Asshole.
What? Yeah. You should shoot him with a pepper ball sometime.
And I am RisenLadyHeathen. Our intent is
With love.
Our intent is to give you this information.
Why are we shooting me with a pepper ball
Because you
sometime
do
for
the thing
fun?
with your hand, and it's hard for me not to say something, and I don't actually have anything.
Okay.
Our intent is to give you this information from three different perspectives. Mr. Rex is a boomer, of course, Hassel is a millennial, and they both eat, sleep, and breathe politics. I'm a female millennial, and I'm learning about politics. We want to inform you, our listeners, on news and politics from each point of view from our literal round table. Let's dig right in. Tell me about Meshawn, Maddock, Litterbox Shane.
What is this? Oh, god damn
Oh,
it.
yeah. I'm sorry. I have reached the point where I am convinced that there is a secret contest among the dingy wingies on who can say the most outrageous thing. And I think once a week they vote, and they probably get like $10,000
Idiot's
for...
version of a reading of whatever that horrible fantasy book is.
Oh, yeah.
You get together, you read it, and when you laugh, you have to hand the book on.
Yeah.
And it is bad, because there's lots of words where, yeah, that's... So those are homophones, buddy.
So, Meshawn Maddock, who is the Michigan GOP co-chair, has been promoting a conspiracy theory. That conspiracy theory is
Bum, bum, bum.
that in the middle school class or bathrooms, they have put down litter boxes for the furries.
Fuck them, they goddamn should.
I just...
No, I don't even care vaguely, and God damn it.
How incredible.
That statement is just stupid on its face.
Unbelievable.
Do you remember high school? What do
Yeah.
you think the odds that you'd shit in a litter box for any reason?
Yeah.
I mean, I'd say it'd be like to avoid physical violence, but no, I would choose violence over that. Like, I am not shitting in front of the other monkeys.
Yeah.
On the other hand, like, Paris Island doesn't have walls on its stalls, so, like, at some level, it really doesn't matter if you're in there to shit. What the fuck else are you doing in there?
The
And
standard
smoking.
thing, but at 2 a.m. when there's nobody else.
The hell are you doing in school, Beth? Oh, no, wait.
Well, I was talking about military bathrooms.
Yeah, fair.
Okay. So anyway, because you get to about week 6 and you go, I wonder if it still works.
It does.
So yeah. So anyhow, I please. Okay. So I assume she was the winner for last week. She's also one of those 16 Republicans who signed the fake electoral certificate. Former President Donald Trump had won Michigan, which is, of course, a federal felony. Actually, it's several flavors of federal
Yep,
felony.
they had to transmit it somehow, too.
Yeah. Anyway, it looks like various prosecutors are getting interested in that because that was a big thing. And so you've got, conspiracy to commit fraud. You've got fraud. You've got, so anyway.
No,
Yeah.
I just think this whole litter box thing
3 years
is
to
just
do it.
insane. Like, how dumb are you?
Yeah.
Like, what good do you think that's gonna, like, saying that is gonna do? Like,
That's the problem with this for me, is everyone
How
who
can you be
hears it-
stupid enough to say it in public?
how
Because
could you be
it works.
stupid enough to even think?
How
is
did we
my
get
bigger...
stupid enough that that's because everyone knows she's just being shitty, right? She just wanted to say a rude thing, and she couldn't say about any other group she'd get in real trouble for, so she made something up.
About the LBGT.
Yeah, exactly.
Who already go through fucking
Oh,
enough shit?
fuck yes.
Oh, yeah. Well, just wait.
Yeah,
8 or 9
There's
states.
no
in that.
bottom to this.
Yeah. So anyway, and the appropriate punishment for those 8 or 9 states that are, writing anti-LGBTQ laws for their schools and so forth is to have every major corporation move.
Yep.
Oh yeah, that's ridiculous.
Yep. Go someplace where there are actual people living.
No, fair. All right, tell me about the Taliban threatening NGO workers.
So yeah. So apparently the religious police in Afghanistan have told NGO workers that they're going to shoot them if they don't wear the burqa.
Yep, and they appear to have banished those 2 women activists the night after their protests.
Yep. So anyway, they have to be driven to work. They have to be escorted by religious police will enter their workplaces and be sure they're all behaving and yada, 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 yada. And my first response was just walk away.
Yeah.
Right? Make sure they never get $1 from the international community.
Yeah.
Right. Just let them starve.
No, they're having a bad winter there.
And when people bitch, you say, what you should have done was pick up a rifle and stand a post.
Mm-hmm. Oh, God, yeah.
Drop guns to the
But
starving
I
9
decided
million.
that's actually not fair. Let's not punish the people of Afghanistan. The Taliban are utterly and completely defenseless. Every time they do some shit like this,
Just pop something.
we should take something that the Taliban really wants. Yeah, like a headquarters, right? Or a motor pool, or their fuel depot. Just take it, destroy it, utterly.
Yep.
And say, every time it happens, it's going to happen. We're not ever going to hit the people. We're going to send you the money, but we're not going to let you buy new fuel.
No,
And we're not going to let you buy new weapons.
land a contingent of
And we're
men,
going to
clear that
continue
building,
to kill your
then
leadership
fire.
every time you let this shit happen.
If you
So
work
you
in a
reach
technical
out,
factory,
you get a
fuck
grip
you.
on
I
your
mean,
religious police,
and you can hit it when it's empty.
and you straighten them out.
They do, I'm sure there are some that aren't working 24 hours a day.
Well, and
What,
isn't there a thing?
technical factories and the
Isn't
like.
there a thing where you can say we're going to bomb this area, make sure it's clear, and then just
Oh, never. No,
Yeah, that's
don't bother.
Hit it
But
a low
anyway, it
occupancy
should be-
time. And
They should be very targeted, they should be very surgical, and they should be very destructive to the interests of the Taliban. The central Taliban, the ones who are supposed to be in
Yeah.
charge. And you keep just fucking them up until they get control of the other sheep herders. So. All right, so we also had, I am so angry that we didn't have weekend shows. Remember the monkeys that were on the loose
Yeah,
and CDC had
monkeys.
said stay away from them? And
they all gone.
so I had a bet.
Yeah.
I wasn't the least bit worried about them. I understood
Yeah.
perfectly why the CDC wanted you to stay away from them. Do you know why?
They have monkey diseases.
They were freshly caught. They were on their way to the lab. We
Yeah.
had no idea what diseases they had,
Yeah.
right? So, but of course, your first reaction is,
God damn it, monkeypox. You're never going to win if you don't try harder.
yeah,
Fair.
yeah. No, but your first reaction is, this is the opening scene in
Outbreak.
28 days after. Yeah. It was 28 days after. the
28
rage,
days later.
wasn't it?
Yep. And then 28
28
weeks after
Yeah.
is the retaking of the city, where they plan to kill everybody from step one, which I kind of applaud, but I might have had more than one step.
Fair.
So anyway, I was really sad because I didn't get to put my bet down before it came out.
Yeah.
So anyway, I won my bet anyway. The hell with this.
Good.
That's fair. Barnabas, take a note.
But I love this. Authorities were instructed to secure the area for the Centers of Disease Control and Prevention and the Pennsylvania Department of Health. We're asking everyone to stay away from, again, this is the opening scene, right? This is the one where you
Little
sit there
kid
and
makes
go,
friends with the monkey.
"Oh."
Yeah, it goes galloping into a playground, plays with a kid for a while.
Yep.
They sneak it home.
Yep. Or just get bitten.
Yeah.
Yeah. And,
Well, they'll get bitten when they're trying to explain sharing of the cookies.
Right.
and the, no, and it just, oh God. Yeah. And, the back of your mind is going, gain of function research.
Did they find
Nope,
any
not
of
even
them?
a little.
They found all 4 that escaped. They're all dead.
Yeah.
Oh, they just killed.
Once you give the monkey hyper
They couldn't
AIDS,
get
there's
him out
no
of
chance
trees.
it's ever going in a truck again as a life form. As a corpse or some slides, maybe.
No, it's leaving the site as
Ash. Yeah.
so.
All right. Tell me about these fake electors.
No, we've been talking about it. There are at least 5 states where they had virtually identical forged documents with new electors. And we're beginning to know who gave them the templates
Yes,
and so
Giuliani.
forth. And yeah,
And the White House counsel, according to Epstein's confession on air, which, what the fuck are you doing?
I know.
I don't know if you were going to do that story. If you were, sorry.
No, but it's all perfectly legal. It was done according with the White House,
Yeah.
the White House legal team. And
Giuliani. He named Robert
Guys,
Giuliani by name.
I'm sorry, you're a fucking lawyer. Right? You knew damn good and well this was fraud. So anyway, as I said, there appear to be a number of prosecutors who are interested in pursuing this. So,
Good.
yeah,
Fuck 'em.
yeah, absolutely.
All right. So Biden sends Ukraine quote unquote lethal aid. Tell me about this one.
Yeah,
send them
I mean,
anything they're
it's nice we
for.
sent them something. And we've continued to send them what we were calling lethal aid. What I'm hoping is that it's thousands of AT-4s, that you give one to every soldier in the Army.
Yep.
And say, when the tanks come, run off, hide in the woods. When they're halfway past, shoot them in the side.
Yep.
So-
Yep.
And they will not survive. Oh, and stay out from under the descending cupola.
Yep.
Right.
Anyway, I'm not at all convinced we're going to come out ahead on this one, so we'll see.
All right.
Trump says it would never have happened in his administration. No, because he'd have been
Ukraine have
on his
already
knees
been
giving Ukraine
Russia.
to Putin.
Right.
So,
Well, it's not surprising. His advisors are the expansionary people who are setting up Russia's effectively Eurasia goals.
Tucker Carlson's people are calling people to be supporting Russia. Say what?
Yep.
At this point, it's obvious that there are big chunks of the Republican Party that
They're done with
are-
the American experiment.
Yeah, and they are simply,
Going for
tools of Putin.
Yeah.
So,
Well, and we'll see how that all plays out. But I don't like it.
Nope.
I don't like it
it
at
all
all.
depends on whether or not you want to live in Russia. You want to live in
No,
Russia,
you
vote
don't.
Republican. So,
Sorry to our Russian viewers. I mean, I love you, but what happened to Russia is ugly beyond words.
Oh God, yeah.
And I don't know.
No, I worry that a lot of these Republicans are really, talking very highly about Russia and what's going on there and blah blah blah. And I'm like, I
no,
have
they
been
like
seeing a lot
strong.
of good
They
stuff
like
going
strong
on.
men. They like fascist
Yeah, but
organizations.
what's the organized crime you bring in to complete the hop to
So
club?
hey, as long as you understand the courts will mean nothing, that votes will mean nothing, that vote Republican.
That night restaurants will have to occasionally deal with the fact that sometimes people walk in and machine gun someone at the bar.
I mean, I've
Try to
heard,
stay out of the way.
I've
Yeah.
heard people talking that this could lead to another world war. So we'll see.
Yeah.
And that could
No,
be
this is the kind of
potentially
mistake where somebody
disastrous
gets
for all
hurt
of
bad
us.
enough that, yeah.
No, we got to be very careful with this, and we'll see. We'll keep.
Which is what I
talking.
think I'd be telling the Russians, right? I think I would just be publicly be like, here's what we're going to nuke. If, like, fuck around and find out, bro. We stood threatening each other with nuclear weapons for how long? And it's not like anybody's gotten rid of any big chunks of them.
No.
And I
So-
bet ours come out the ground.
Here's Yep. So anyway,
Tell me about Georgia. Lines were crossed.
so Fulton County's heating up.
Yes.
The special prosecutor has been approved
Yep.
to investigate what were clearly election irregularities,
Special
including
grand jury, wasn't it?
Trump's yes, I'm sorry, special grand jury.
So now they have subpoena power.
Nice.
Yeah.
Do it.
So anyway, they can get, Trump in and Ratzenberger in and
Yep.
talk about the conversations they had, one of which was a felony. So, hey, anyway,
Yeah. Well,
it's done.
We'll see.
Step one, down.
Step
Yeah.
one.
And unlike a grand jury, this will put forward a thing of whether or not they think they should be charged as opposed to orders
Yes.
to indict or not.
Right.
So they haven't given up the decision of power for that.
All right. So let's move on to our segment, What to Fix. We promised you healthcare numbers and a general discussion about who in the world has good healthcare and blah, 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 blah. So
What'd you find out?
let's get into these numbers.
I saw you
because-
grinding your teeth all day.
Oh, Jesus. Fuck. It's just no good. It's no good. So I started looking this up last night, and then it's just so bad that I finished it today because I was like, I need a break. But U.S. health insurance numbers. Okay, so in 2020, there are there were 329.5 million people in America. Okay. 297 have some form of health insurance. 297 million. So 10.37% of people in the U.S. didn't have any health insurance.
Right.
So now I also asked the question: how many people are underinsured? No numbers.
Interesting.
There are no numbers on underinsured.
Underinsured's probably not a well enough defined term. I want to go back to the uninsured.
Yep.
Right? Because this is the most expensive mistake it's possible to make.
How so?
Because uninsured people don't go until they are in desperate need of very expensive treatment. Especially the older ones. By the time they go, they're in that final phase of life where you're going to spend 3/4 of what you spend in a lifetime on medicine.
Emergency medical care.
Well, and in-house care and so forth. It's insanely expensive to treat things we could have treated earlier and actually done something about. And it winds up with a dead person with no money who's not going to pay you. So who pays that? Well, the hospital puts it on their profit and loss sheet as a loss. And so the next time they're asked to set their prices, like for your insurance company,
they know how much they have to.
They know how much
on.
they have to add in
Yep.
to have you and your insurance company pay for those 30 million uninsured.
Right.
That's what happens all the time.
So now one thing to remember is our 65 plus, our elderly, basically have universal health care. All right. So majority of our elderly population have health care. All right. But when we're talking non-elderly, okay, so that's the majority of people who are uninsured, 5.6% are children. Okay. Now, the reason why that number is so low is because most states have really good programs to help children. So, and mothers I know New Hampshire has a really good assistance for mothers.
All these little different programs when we could have one big one. And anyway.
Right. So that's all covered by.
We're gonna give it to the states as block grants.
So the reason why that number's low is because most of it's covered by the states. Okay, individually. 11.2% of people who were uninsured had one or more people working part-time. So that's a significant amount. So you're working part-time and you still don't have insurance, right? 12.
Well, in fact, in many cases, if you've got some income, you can't qualify for Medicaid.
Now, this number is just horrifying. 76.1% had one or more full-time workers in the family. 76.1% of our uninsured are working at least full-time and have at least one full-time worker in the family, but they still can't afford health insurance. Ridiculous.
Welcome to America.
We decided we were going to make a bunch of profit off of getting rid of the middle class.
And only 12.7% had no family members working. Okay. So that's a pretty low number of the percentage. So the real problem we have here is people who are working part-time or full-time that aren't getting any insurance at all.
Don't worry, Mark Cuban's going to save everybody.
So in 2020, there were 10.5 million people who had insurance thanks to Obamacare.
Right.
So if it wasn't for Obamacare, that 10.5 million would not have had insurance. Now let's get into how much health insurance costs, like regularly. Okay, so on average, healthcare insurance costs monthly, or you know what? Let's start with weekly. Okay, so weekly people are spending for a single person $105.23 weekly. That's a lot of fucking money for some people. When you're bringing home a paycheck,
$5,000 a year.
When you're bringing home a paycheck that's weekly at $300, we'll say $350.
Yeah.
That
hurts.
That leaves you with two something. Like
big surprise, there are a lot of uninsured.
It's
that means if you're getting paid $13 an hour, one of your days goes to paying insurance.
Yep.
for that week.
Yep. Now for a family, right? It costs $265.84
Weekly.
for a family. That's
3 days work. Yeah.
so. Okay, that's your housing right there. That's your housing money gone.
Sure.
Goodbye.
So now
Thanks for
both
playing.
parents have to work
Yep.
as an absolute minimum.
Right.
Right.
And at least one of them has to be paying this ridiculous amount
Yeah.
to get health insurance.
Ain't
for the
America
whole
great?
So monthly, that's $456 for a single person and $1,152 for a family.
Yeah.
So if you're making $3,000, $4,000 a month, $1,152, that's like a third or a quarter of your pay, depending.
Yeah. It's another house.
Yeah.
Oh, wait, you can't buy a house. Never mind.
No, you can't even afford your rent. Or
So-
you don't get health insurance and you pay your rent and then something bad happens and now you're
So that $1,000 a month for a family is about right. Right. So $12,000 a year for a family.
13,824 yearly for a family. So yearly for a single person, it's $5,472.
Yeah.
But I really wanted to start with the weekly numbers.
A lot of
because
working
that
folks
is-
can't afford that.
No, that is
No,
insane.
that'd make me angry if I was a working folk.
Oh gosh, yeah. No, and with my Obamacare, I was paying, I think it was $80 a month for really good coverage. So if you're struggling, Obamacare might be
Your
might be
solution.
your answer. Yeah.
Yeah.
So let's discuss Hawaii. Okay. Hawaii is known to have universal health care. Now, they don't have full universal health care. So how they did it is they have over 95% of people in Hawaii have insurance.
Okay.
And how they did that was they forced employers to provide health insurance if the company has more than 10 employees.
Okay.
And their employees are working at least 20 hours.
Good. Like that.
So most part-time jobs are considered 32 hours.
Yeah.
Full-time is
Yeah.
40 hours. So at part-time at 32 hours, that's how in most places in America, that's how these companies get around.
Yeah, they just give you 32
Yeah.
hours. You're not full time. You don't get health care. No
Yep.
problem.
You work 6-hour days instead of 8-hour days, or you work one day less, or whatever. But they give you 32 hours just so that they don't have to pay you, because if you
Exactly.
do 33 or 34 regularly, they're required to. But anyway, it's just insane. And Hawaii fixed this by dropping it to 20. So basically, you're working 2 days a week, you're getting health insurance. Fuck off. So it's working really well for them. Hawaiian residents enjoy a longer lifespan than other Americans on the mainland. They are some of the healthiest people in the country. And now, here's an interesting thing. Hawaii has one of the highest cancer rates. However, because of their health care, more people get caught early, right? So they catch
It's
the
treatable.
cancer early and are treated more quickly, and therefore have significantly better outcomes. So even though, they get, I think it's like 50% higher rates of cancer, but they have significantly lower rates of loss.
Okay.
So,
Because they do something about it.
and they catch it
Holy
early.
shit.
And in
You
Hawaii,
mean if you actually do medicine, it works?
Who knew?
hey, guess what? In Hawaii, if you're sick, what do you think you do?
I don't know.
You go to the doctor because you don't have to worry about paying for it. It's covered, man.
Place that Breaking Bad can never work out.
No, but
You
it's
didn't go to Hawaii.
They have a whole different culture there, right? If you have the sniffles, if you have whatever, if you're not feeling good, if something's not feeling right, you will just go to your doctor and be like, I'm not sure what's going on. And they'll be like, oh, well, let's find out. They don't even talk to their people about like, well, we might not be able to do this thing because you don't have good insurance, and can you afford this, or blah, blah, blah. They don't even have that discussion. It's just covered.
Yep.
You're good. We'll take care of it. So come on, people. This is working out. Now, oh shit. So which other countries offer universal health care? I almost shit myself when I
you
saw
the
this list.
map.
Spoiler warning, most of them.
Yeah.
A significant
Which ones don't?
amount of them. Oh,
Who's like us?
I don't even know.
Oh, okay.
Hold on, let me pull this up because it was too much. Like I would have been writing for just hours, all of these people. So
every country you've ever heard of, basically.
Right. So
Even a couple of countries I would probably fight not to go to.
So most of Africa has free universal healthcare. All right. Now some of them have what's called universal but not free healthcare. And some of them have free but not universal healthcare. So there's different levels of it, right? But
in short, every country we would normally compare ourselves to has national health care. Every single one.
Yeah, done.
I'll go back and make the list of those that don't.
They don't have a government.
That's a rogues list. We're right where we belong.
No, China doesn't.
Kind of what?
Okay, so they're 95%.
So Egypt has a system where you can go and get free healthcare. However, if you make enough money that you can afford to pay out of pocket,
some of it.
then you will.
Yeah.
You will pay for it. But that's only if you can afford it. If you can't afford it, you can just walk in and be like, oh, I got a cold or something.
Imagine the Republican response to that.
Right.
What do you mean poor people get it free? Why don't I get it free? I'm so jealous. I don't like this system.
Right. Rwanda operates a system of universal health insurance through the Ministry of Health, a system of community-based insurance where people pay premiums based on their income level into local health insurance funds, with the wealthiest paying the highest premiums and required to cover a small percentage of their medical expenses, while those at the lowest income levels are exempt from paying premiums and can still utilize the services of their local health fund. In 2012, the system insured all but 4% of the population.
Way to go.
Well done, Rwanda. Okay, like Jesus. Let's see what's going on in Asian countries. Dead air.
Right?
Well, we can talk about,
So Mark Cuban's going to fix it. Mark Cuban opened an online pharmacy that's charging a 15% markup and I think 4% pharmacy cost, as opposed to hundreds to thousands of percent markup.
yeah. Well, and he will negotiate prices and so forth. This is one where the traditional drug distributors may find themselves not just hurt, but badly hurt.
Yeah.
I have found 3 occasions where, and I supposedly have good health care and good prescription coverage and so forth, where Walmart's price was cheaper than my insured price.
India. At the federal level, a national health insurance program was launched in 2018. This was aimed to cover the bottom 50% of the country's population working in the unorganized sector, and offers them free treatment at both public and private hospitals. For people working in the organized sector and earning a monthly salary, they are covered by the social insurance scheme of employee state. So basically, they cover, if you're in the bottom 50%, they cover you. If you're on the top, they expect you to be able to get your own insurance, which fine. I am fine with that. But again, significantly.
But imagine,
better.
imagine telling your standard Republican that, right? That we're going to look after the lower half, and those of you who make enough to afford this rationally are going to pay it.
Right.
And no, I want it free too. I'm so jealous. I don't want this program because people who have no money get something I don't get, and it makes me feel so bad and so jealous and so angry, and some of them are black. So, anyway.
Israel has a system of universal health care as set out by the 1995. Back in 1995, they started this national health insurance law. The state is responsible for providing health insurance to all residents of the country who can register with one of the 4 national health service funds. To be eligible, a citizen must pay health insurance tax. Coverage includes medical diagnosis and treatment, preventative medicine, hospitalization, surgery and transplants, preventive dental care for children, first aid, and transportation to a hospital or clinic, blah, blah, blah. Yeah, so basically they cover most things.
Yeah. Now let's talk about Israel for a little bit.
Yeah.
Because since the beginning of the COVID pandemic, if you wanted to know what worked and what didn't work, you went to look at what the Israelis had done.
Yeah.
Because the Israelis got ahead of it, they studied it, they figured out what worked, and they distributed it. So that's what a national healthcare system can do for you.
Mm-hmm.
Right. As opposed to ours, which did.
No, it wasn't that we failed to do. We actively obstructed our plan to do
Yes.
sensible shit.
Right.
Kuwait just offers straight up universal health care. Good job, Kuwait. Macau offers
Not just for
universally
casinos.
accessible single-payer system funded by taxes. Healthcare is provided by the Bureau for Health. Again,
Yep.
duh. I mean, these are countries that Pakistan. Universal healthcare exists on provincial levels, started by the government of Khyber. Oh, we are not even trying to pronounce that, folks. Which has launched a universal health insurance program known as the Set Insaf card to provide free health care for the residents of KPK, where families would be covered up to 6,200 American dollars for treatment. This was further expanded to the province of Pakistan in December 2021 and covered more than 31 million families. So, yeah.
Whole lot of countries.
Mm-hmm.
And here we are.
Sri Lanka provides free universal healthcare to their citizens. End of discussion.
Yeah.
And anyway, so these people who are going to go on and tell you that, oh, well, it doesn't work. Just fucking Google countries with universal healthcare. There's an entire Wikipedia page. And again, like reading through this, there's just so much. There's so many
by comparison
countries.
with Western Europe, which should normally be a legitimate comparison, the U.S. public pays twice as much per year for medical, right? And this is all sources, right? This is all insurance sources, all personal private sources, the whole thing. But our expenditures on healthcare are roughly twice what they would be in any Western European country. And we have a standard of care and outcomes that are virtually identical to those of Turkey.
Yep.
So again,
It's one of the
You
things
can
that makes
get
us
better,
less
but
like
you
the
can't
countries
pay
we
more.
want to be compared to.
Yeah. No.
It's
The whole
something to do
system
with
is broken
freedom,
almost in every
eagles,
respect.
probably sprinkles,
But
Germany-
hey, lots of folks are making big money on it.
apple pie.
Yeah,
Germany
I mean,
has
the
the
CEOs
world's-
of those health insurance companies, 36 million a year in salary.
Oh yeah, they're making big. Germany has the world's oldest national social health insurance system, with origins dating back to the Otto von Bismarck's sickness insurance law of 1883. Employees pay for half of their employers pay for half of their employees' health insurance contributions, while self-employed workers pay the entire contribution themselves. Approximately 90% of the population is covered by a statutory health insurance plan, which provides a standardized level of coverage. one of approximately 100 public sickness funds. The rest is covered by private insurance. Private health insurance is only accessible to self-employed workers, high-income employees, and BMAT, whatever. Yeah, so they have really good healthcare. Jesus. So anyway,
And haven't fallen to the scourge of ultra communism or whatever.
yeah, no.
Yeah.
Most countries have some form of universal-ish type healthcare where they're covering, significant portions of, what people need to pay. And I think that, get taxed, right? And that tax goes to pay health insurance. End of discussion. Like,
Yeah.
and that way everybody's paying it. Nobody's being whatever. It's just stupid.
Yeah.
You would think a country that invents things like monster truck rallies and rodeos would
Be
like,
able to handle
yeah.
this relatively trivial problem.
I'm just thinking of the dumb shit I've done recreationally, and like, yeah, no, we definitely should have universal health care.
Yeah, it probably should. Again, it's all a matter of, at this point, we have a handful of very, very rich people who are in charge of the government, and they have decided they'd like to make more money rather than make America work for everybody.
Yeah. Did you see the
And that isn't going to continue to work.
story about who did the Daily Show? Past tense. Jon Stewart. Apparently he was at a dinner with Obama and the Obamas and Bezos and some other people. And Jeff Bezos was explaining his idea for the gig economy and all of that and how, the economy should grow into, as Jon Stewart put it, poor people basically doing errands for rich people.
Yeah.
And he pointed out that's a
Well, the
recipe
rich
for
people do
revolution.
their,
And Obama agreed with him because, it really is. But
Yeah.
on the other hand, he did also quite
meanwhile,
promptly-
you've got the rich folks doing their vanity space flights.
I have Obama not telling the American people that the Russians worked hard to influence the election through memes and the use of social media. Because
Yeah.
Mitch McConnell said he would burn the world down. And cool. They appear to be burning the world down anyway.
Yeah.
So,
Obama probably should have reached down, grabbed his gonads, and driven on.
been a president when we needed it.
Yep.
No, I think that, this just goes to prove that everybody being like, we can't do universal health care, it doesn't
Oh, yeah.
work, blah, 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 needs to shut their stupid fucking mouths and stop it.
Yeah, it's been
Well,
a
since
lie
all
for
of the
years.
data says otherwise.
Yeah.
Yeah.
Every bit of the data.
Most countries that are like established countries and whatever have some form of universal health care or force like in Hawaii, if you work 20 hours a week, you have more than 10 employees and they work more than 20 hours a week, guess what, you're getting them health insurance.
Yeah, it just becomes a cost of doing business.
Yeah.
And if your business can't survive that, it wasn't a good business. Go find a
Hawaii's
new one.
doing really good, just so you know.
Yeah.
So
Well, it helps that it's Hawaii.
Yeah.
Lots of people want to go there and spend.
And it's crazy ass expensive to live on Hawaii.
oh god, yeah.
And all islands are.
So what else have we got?
You can become, no wait.
I got numbers on uninsured veterans. 1.3 million veterans are uninsured, and 37,252 veterans are homeless as of 2020. So these numbers are bad, and again, universal health care would solve a lot of this.
Yep.
Well, and again, we'll tackle the homeless for a minute. So the standard city's approach to the homeless is just bulldoze where they live.
Yeah,
Right? Throw all
drive
the shit
them out.
away, drive them out. Right, out of sight, out of mind, no
Or,
problem.
or literally bust them to other towns.
Yeah. So there are more and more homeless.
Oh yeah.
And again, we haven't started the eviction surge from the pandemic yet. So we're going to have a whole lot more folks living in their cars if they have cars.
While they have cars.
If we want to fix this, and I promise you, you want to fix it,
Yeah.
then we have to start talking about, where do we house them? How do we provide the appropriate kinds of support, right? A lot of them are drug dependent. Okay, how do we manage that, right? How do we get them out of that loop? How do we get them back to a point where they can control? They don't want to control. Bullshit.
Everyone does.
Everyone wants to contribute. And anybody who doesn't believe that's a fucking Republican. So.
Yeah.
No, it's these people don't want to be homeless, most of them, right?
No.
I believe
Being
that there might be
homeless is
some
not
people
cool.
who, kind of just learn to live with it and like whatever. But
No,
I
it's the
don't
same.
feel like, I don't feel like that's really like as much as people want to believe, right?
Of course not.
People want to be, well, they choose to be homeless. Nah, kind of.
They want to believe we can't do anything because they haven't seen us do anything in a long, long time.
So back
Most
when
of them were born immediately following the last time we did anything.
Fair.
And they can babble about the moon and stuff, and that's cool. Did that make microwaves? Actually, no, it didn't. Fuck. Yes, good job, brain.
So anyway,
Not knocking the moon thing. I know you got a big moon hard on.
back when I was spending some time in DC and living in a relative's apartment when I was there, the apartment was 2 blocks from Lafayette Square. So Lafayette Square is a big homeless encampment. I don't know that they're allowed to spend the night, but and after getting over some initial fear, and I will admit, dressing down, right, t-shirt, blue jeans, so forth. I went over to Lafayette Square to talk to people.
Right.
And no, it's a shitty way of life. They don't like it. And the standard, the kind of standard story is, had a job, had a family, right, got involved with drugs or whatever, right.
Gambling.
Yeah. Had a life fuck up.
I don't think I ever had one mention gambling, but yeah, that would work. And their life fell apart. And they found themselves on the street. So, okay, you're on the street. You're not going to go to a job interview because you fucking stink.
Yeah.
Right?
Well, you can, but you're not getting the job.
But you're not getting the job.
Plus, you don't have a phone, so
Yep.
they can't call you.
Yep. Anyway,
That's what those Reagan phones were all about.
yeah,
And then they
the
became
whole
Obama
idea
phones and...
that somebody who had no other means of communication might be able to find a job if they had a phone number to write down on the application.
Yep.
Right? Just a wild thought.
Yep. Well, and as smartphones became the dominant flavor of phone, we started giving out smartphones because, shit, if you can get on Wi-Fi, you can apply online to a lot of things faster.
No, and again, a lot of people you find, that are just given a little bit of help, right? A place where they can be safe, where they can shower, a fresh pair
Set
of
of clothes,
clothes,
yep.
and you take them to job interviews, and maybe they don't know how to interview, so maybe you practice with them a bit first. You know what I mean? There are very simple things that could be
Well, and you
done
might also-
to stop this.
Yeah. You might also develop a handful of companies that understand these problems,
Right.
that are in some way or another provided
It's effectively a more
resources.
complicated temp agency.
Yeah, with the right kinds of support and psychological and so on.
It's a place those people can be picked up by the rest of the system.
And
What
you
we
get
need are
them
fucking
started,
effectively
you
bus
get them into
stations.
the routine, and at some point, when they're ready to graduate, or you'll find some leadership, right, that'll go around and try to help other folks who've just arrived and so forth. You keep them. The ones who have become decent workers, you graduate them, and you find them new jobs, maybe in a next tier of, or maybe really out in the world. I mean, it depends. I don't know how many steps it would take, right? But all of this is doable. All it requires is resources.
Right.
So,
No, and a good step for that is,
you know where you get the resources?
I would assume the rich people or banks.
You attach the goddamn rich, and they can stop doing their vanity space
Hold on.
flights.
Wait, yeah, shut up. Can I just have the IRS rob motherfucking banks? We're the insurance company that bank. Victimless crime. Unless somebody wants to play around and... Just saying, the government's got that billion bullets or whatever.
No, and I wanted to look into.
I just wanted to see if I could make Boomer Rex's eyes roll so hard I could hear him.
Oh, God.
So I said the billion bullets thing, so that's a big thing for the crazies.
Fair.
And it's just training ammunition for everybody.
I wanted to look into the for-profit. How much is for-profit? Kind of, sort of, the closest I got was like 24%, but that's
Was for profit? I'm surprised it's that
sounds
small.
low. So again, like, it's hard because it doesn't distinguish like for-profit from like whatever. So I don't really know what the truth of that is. I wasn't able to.
Well, it's like finding out about those, not the health savings accounts, Brian, be useful right now. The ministry nonsense that isn't really insurance, but lets you avoid the tax penalty because once you're sick, you're going to end up on Medicare.
But the insurance companies
No,
are
the other
making,
one,
I think it was 22 billion a year, like, and that's unacceptable. The Obamacare thing made them so that they can only that they have to put, I think it was 85% of every dollar towards the health insurance.
Yeah.
To try to limit how much money they're making. But what they do is like, so how if you go to one hospital, you pay one price.
Yeah.
If you go to another hospital, you pay another price.
Mm-hmm.
So these hospitals that are charging these higher prices
Yeah.
are the ones that the insurance companies try to keep, because even though they take a loss, it means they can charge more.
Okay.
So they
An
try
economic
to,
shell game.
Exactly. They
It's
try to
healthcare.
They get to bid
being
again
infected
based
by
on what
branding.
money they've made or lost.
Yeah.
The more you lose, the more you make next year. Yeah. No, idiotic.
Well, you can tell that looking
So-
at what's taking over rural healthcare in terms of the vulture capitalist assholes.
Yeah.
And then shutting down your emergency room because that will always be a loss.
Yeah. HSAs. HSAs work well for people.
Yeah, I'm not
in
talking about
some-
that. This is actually a godbotherer nonsense scam.
Oh, okay,
This is
fine,
a thing
sorry.
that Obamacare enshrined into existing because they didn't want to fight religious nut jobs
Okay.
over a thing that it's a. I don't know. It's not even a Ponzi scheme. I guess it is because they charge a premium.
Yep, you have to pay
And they
a
never pay
premium,
out
and
anything.
They
Deny more service than any of the previous shark models for real
Oh, cool.
insurance company.
so they charge you a super low number, but they're going to deny you everything.
Okay.
Every time.
Yeah.
People
So, no,
had to take
the-
them to court to try to get any amount of money.
Health savings accounts are as nonsense as 401ks. They're great for nobody, but sure, there's a number of people. There's exactly enough people for it to be annoying because they're like, it works for me. Cool.
Yes.
I need
Agreed.
you to look out the window to where the people with pitchforks are going to show up. No, where our society will just get coarser and coarser. And
Yeah.
we're already there on a lot of fronts. Just, when
How
was the
many
last
people have
ti-
gotten pushed onto the tracks in New York in the last week? Wait a minute. I think it's up to 4.
Hey, if you think it's working really great, when was the last time you got pulled over?
Pulled over.
Not you, but I'm saying to the people who think this is all fine. Like, we should go back to the new normal and everyone should shut up.
Right.
It was worse back in their day, something uphill both ways. Who gives a damn?
Yeah. That's good. But in answer to your question,
On a planet that had 50% more biodiversity, yeah.
I haven't been pulled over since I was
Yeah.
17.
No, but you had that interaction with the cop at Dunkin' Donuts.
Oh, yeah.
That's what I'm saying.
Okay.
Is when, like, if you haven't recently had the cops think you're the fucking scumbag,
Yeah.
you're not having the average American experience,
Agreed. Okay.
Yes.
Fine.
right? If you don't understand why people are afraid when the cops pull them over, you've had an incredibly charmed life. And good
Yeah.
for you, buddy. But, hot damn. Like, they're gonna blow something up. I don't know who. We've seen
No,
one.
I was pulled over. I was pulled over by a stupid, scared young cop
Yeah.
in one of the outlying bedroom communities.
Mm-hmm. How'd that go?
Because I pulled in, I made a wrong turn and I pulled into a utility company parking lot to make a U-turn, and he
Yeah.
decided I was a bad guy.
Obviously.
Um,
Chasing the joint.
So he pulls in, and I got out of my car and started
Jesus.
walking toward his to say, "I'm lost, help!"
So this was a
And
million
he jumps
years
out of
ago.
his car with gun drawn.
Yes.
Stay where you are.
Yes. Absolutely.
Yeah.
The people who come out of cars are going to be shooting.
Nope, I should have grieved him to everybody in sight. It was the most unprofessional encounter I have ever had with a police officer.
And I don't know. Like, I wasn't alive in the time when you got out of your car during traffic stops.
Yeah, no, that's
Yeah,
like
that
the
was a
last
long
thing
time
you do.
ago.
Yeah.
I remember when I was young, I even asked the cop one time, "Did you want me to step out of the car?" Because I wasn't sure where he was going, and he was like, "No, no, you're fine, stay there." And I was
Yeah.
like, "Okay."
No, it stopped the first time. I mean, I was always taught you get out of the car and walk back and talk to him because now he's on his turf and you're much better off.
Yeah.
Right. Um,
And then the Miami
And-
shooting happened.
so it ended probably 1971 or 2.
Mhm. Immediately post.
Where I had been going about 120 on the freeway. Got off the freeway. I saw the lights behind me. There's a little hump where you exit the freeway, and I saw the lights behind me go, oh shit, he's traveling. God damn it, that's a cop. And I could have ditched him.
Yeah.
I could have turned right in the neighborhood. He'd have never seen or heard me again. But I let him close on me, turned on his lights. I pulled over and I got out. And he got out of his car behind his door. He did not draw a pistol.
Yep.
And he said, would you please sit in your car
Yep.
until I'm ready to talk to you? I said, okay.
Yep.
So anyway, then he made me get out. It's pouring down rain. And when he was finally ready to talk to me, he says, okay, get out of your car, come back here, put your hands on the hood of my car and spread your legs. And the whole time he's saying, I'm so sorry. This sucks, but it's raining. And then he put me in his car and wrote me a ticket for 10 miles an hour over the speed limit. It was the last ticket I ever got.
Well done.
Fair.
Yeah, I'd been going
Yeah.
65 miles an hour over the speed limit. So
Yeah, but so anyway, no.
I did point out it was 2 a.m. There was nobody else on the road and it was perfectly safe. And he agreed.
But no, so again, like these numbers are pretty damning for all you idiots that want to talk about universal health care doesn't work.
Well, or
Socialist.
that we don't need to raise the minimum wage so they can just afford the fucking insurance then.
Yeah, that would work too.
We could just, in fact, pay minimum, middle class wages and solve the problem.
Yeah.
Yep. Nope. So this is all very easily fixed, and it's done. It's been done for years.
Well,
In some
we can
cases,
copy the body
at
of work.
least 100.
We know what's been
years.
tried.
Yeah.
We know what doesn't work
And we've
well.
got the result in a lot of cases. The government organizations that run the national health care have enough data for us to look at and say, what is working, right? So that we could actually build a program that would work.
Yep.
And work well. And we spend $2 trillion a year on healthcare and get healthcare that's worth about $800 million.
Yeah.
Right.
So if you actually were to fix
All
this,
those people who always talk about waste, fraud, and abuse. Hey, I know where there is some for real.
Lots.
there's $1.2 trillion per year that could go into the U.S. economy.
They go into the
if
military
we
spending.
fixed healthcare.
Yep.
Yeah, shut up. I got a plan.
I would prefer it didn't go into tax breaks for rich folks, but hey.
Yeah, no, I'm gonna make it right. We're gonna force it into military spending, and then pass a rule that says it all has to be payroll.
Okay, yeah, I like that.
Because privates will buy 8 little cars
Yeah, they
and
would.
9 car stereos.
Oh, yeah. So. Anyway, beginning to get a handle on where we are. This is a good thing.
And it would flood money into the South.
Into the what?
South. Because we have all of our heavy hitter military bases in the South, because the South might rise again.
As
Having
the,
grown up in the South? Yeah, no. If they even wiggle
as
once,
the
shoot 'em.
South writes laws that restrict voting and
I'd be
try to
tempted to
keep
move.
people of color, I would move my military bases.
Yep.
Oh yeah. Nope. There's many ways that this can be sorted, but
What?
Exactly the reason I kind of jokingly stated, I'm not sure I want to move the military out. I can make the towns off limits. Aye, what do you want from me? But I don't think giving them swamplands where we had previously held all the things to teach the people that lives in the swamps how to be scary. I'm not sure I want to hand them back those facilities. So,
Fair.
and yeah, we could demo the.
Oh, I wasn't going to give them the
Fine.
facilities.
Still, I don't think we want
I
to
was
give
going to
up.
leave a guard force to keep them out.
Fine.
So, anyway. But major corporations should be actively looking to move their big production facilities and just say, we'll take the loss.
Fair.
Right? We're not staying here. We're not asking our people to live in this third world state.
That's what they would do if they want to not have every generation going forward think, wow, capitalism's kind of dumb.
Otherwise, I've got some candidates they could hire.
Well, I love how every time it comes up, right? Because like, oh my God, the millennials aren't sure that capitalism's a good thing because the capitalism they've seen has been rigged against them.
Oh, absolutely.
But don't worry, because Gen Z doesn't have that same feeling. Gen Z is barely in the workforce.
Yeah.
Right. And if you think about it, we could, as
Damn, that chicken
country.
was good.
cover
Oh yeah.
76.1% plus the 11.2% of families that have one full-time worker or more, or have at least one part-time worker in the family. We could cover these people
Yeah.
if we made it more affordable.
There's not a
because
thing we couldn't do. if we wanted.
$105.23 a week is insane.
Well, that was part of the point behind Obamacare was the graduated premium.
Mm-hmm.
The problem is that when you hit a certain point,
It begins to stop.
exactly, it's not worth it.
And the
as much
lack of the
anymore.
public option to put pressure.
And I have known working folks who I was thunderstruck, who would have been asked to pay $1,200 a month for a family.
Mm-hmm.
Right,
No,
federal-
I have my uncle was looking for health insurance one time, and $800 a month for just him, and that's insane.
Yep.
So it's unacceptable, and he's not the only person I've
No,
heard.
and that's why we have the problem we have, right? That people don't end up getting it, and then they get sick, and now, right, they're either completely a loss, or we'll get them on Medicaid, and some fraction will be recouped.
Well, and the other thing is that with universal healthcare or with some form of healthcare, you're more likely to go to the doctor if
Yes.
you're like, I'm really not
Yeah.
feeling good. So you
When
go
we
to the
can fix
doctor
it.
and you catch it early. It costs less to treat when caught early,
Yeah.
right?
One of the most
Which is
important
why
cla-
Hawaii is doing so
One
well.
of the most important classes in medical school is they teach them to look for doorknob questions. That's when people ask you about the thing that's the most important thing. They haven't mentioned this whole other time.
Right.
And it's going to be stuff like, hey, I've been blind in my left eye for the last 3 days. Is that bad, doc? Because they don't want it, right? Again, it's the reason why there's been this huge boom in the bullshit and bug eating community in terms, or the homeopathic garbage.
Yeah.
Because it's going to be cheaper-ish, and it offers more hope.
Yeah.
Because having put off all of it, as we've said, you end up in, right, stage 3 cancer as opposed to stage 1, because I don't want to know what that lump is.
Yeah.
It's not that big. It's fine.
Yeah.
Right.
It's only growing a little bit every day.
Mm-hmm.
I only hear it talking at night. It's fine.
Like the boil. But anyway, so again, these are all easily fixable things, and this can be done, and it has
And we're
been
already
done.
paying for it.
It has been done over and over and over and over and over and over.
And we
fucking
can
over again
save
in almost every
$1
other
trillion a year by doing it right.
Imagine how many more missiles we could buy for $1 trillion a year. We could give the Marine Corps all of the armored vehicles it doesn't want.
That's right.
Mhm.
We
'Cause they
could
are
fly
worse than
B-22 Ospreys everywhere.
right? We could come up with so many cool things to do with the old B-52s for no reason on earth.
Actually, there's a good reason
yeah.
to use
Maybe. We'll talk later, I'm guessing.
So I think that as far as the numbers,
Mhm.
okay, I think that we've proven our point, right?
Yeah.
Especially like seriously, just look up Hawaiian health insurance, and like they're all happy. They just go to the doctor when
Yeah.
they're not feeling good, and guess what? They have longer lifespans than we do here on the mainland, and they're happier
Yeah.
and healthier
Yeah.
significantly.
All of Western Europe has better outcomes than
Yeah.
we do
Oh gosh, yeah.
for half the price.
Fucking, I mean, it would take me like forever to go through the list and be like straight up universal healthcare. The list is long, right?
Yeah.
And it's just ridiculous. So that's why we just kind of pulled the ones that I feel like people would be interested in. Like,
Yeah.
Oh, we were doing fun things with numbers. I've got some fun numbers real quick.
oh, go for it.
So the Mark Cuban online pharmacy that's doing it on the cheap.
Uh-huh.
One drug for diabetes, metformin, sells for $3.90 for a 30-day supply compared to the retail price of $20.
Okay.
30-day count of imatinib. I don't know. It's leukemia drugs. $17.10 at the pharmacy compared to $2,500.
Oh. Are there any others?
Not that I saw.
Okay.
No, I mean, there's examples of others with high markups, but no.
Okay.
You can get some of the cholesterol controlling drugs for like $4 a month. So
Again, that was one of the cholesterol control drugs was the one where the Walmart's price was lower than my insured price.
Yep.
No, I remember I used to get my allergy meds via prescription because it was cheaper. And then after not doing that for many years, I finally went in to my doctor when I got health insurance again and said, hey, could you give me a prescription for this? She's like, I will, but I don't think it's going to help you because when I went to fill the prescription, instead of it being $5 a month like it used to be, they wanted to charge me like $60-something.
Yeah.
And it was cheaper for me to buy over the counter for $24.
Yeah.
But I used to pay $5 for a 30-day supply. Like, what the fuck?
No, again, in the prescription program I'm in, I had a drug go from 60 for a 90-day supply to 450
Jesus.
with no announcement, and they shipped it to me.
thank you, the various pharma bros.
So I now have a rule with them. You don't ever ship anything to me for any reason unless I call you and tell you to ship it.
Yep.
Because I don't trust you.
Nope. No, because when they're charging you that kind of money for something and they're not telling you that, by the way, we're raising our prices on this thing, fuck you.
Yep.
But
No, it was a standard shit. So I had 4 brand new prescriptions to continue prescriptions that I take all the time. Okay, fine. So sent it to the company. So I called and I said, I need the next set of 90-day supply. Well, there are no refills remaining on your prescription. I said, I just sent you 4 brand new ones, right? Well, we don't know what to do with those. And I said, they are replacements for the 4 that have run out. So you take the 4 that have run out and you replace them with the 4 that are brand new and everything will work out. I had to go through 4 levels of supervisor to get them to pull their heads out of their asses and do what they were told.
Yep. But as we learned from AOL, if you transfer a person more than twice, there is a more than 50% increase in the odds of them hanging up. That's the same reason it's almost impossible to dispute a bill with a bank. Because they know if they make it just hard enough, you'll eat some small thing. So, I agree, your case, not a small thing, but we'll see.
Well, and I had
It's worth it in the percentages.
I had the advantage of being able to say, right, if you do not handle this, if you do not transfer me to your supervisor, I am going to hang up the phone and I'm going to call the vice president of HR for a major company, and I'm going to ask her to take care of it, as she used to take care of my wife's prescriptions because you people were so utterly incompetent.
fair.
So, and she volunteered. She said, if you ever have trouble again, just call me.
Sounds good to me. So, yeah.
And it was amazing when a vice president of HR calls CVS Caremark, they fucking listen.
Oh, weird.
Yeah.
No, again, complaining is worth it, and keep pushing for what you know is the right thing, because kind of sort of that's the only way, A, you're going to get any sort of reasonable care, first of all.
Yeah.
And second of all, it's the only way you're going to be able to get any sort of reasonable pricing. So keep that in mind, folks. Don't be afraid to call and keep calling, because the more annoying you are, the more likely they're going to give you what you want.
And unlike me, who has a real problem not shouting at the second layer, most of the people who work there are fine people. It's their system that is utterly and totally screwed up.
Yeah.
Well, and
No,
they
and
don't have
again-
any power to do anything, so everything requires a transfer.
You catch
Right.
you catch more flies with honey. So just be polite about it. Be like, look, I know this isn't your fault, but I need to talk to somebody who can fix this for me, please. And yeah, it gets frustrating, it gets annoying, you get the roundabout and whatever, but keep calling. Eventually they will do something for you. So just to be patient, because again, these people you're talking to on the phone, it's not their fault. They're just following rules, regulations, whatever that they're required to by their company. They got to cover their asses too. So be polite, but certainly be firm, right?
The one I adored was about 15 days after this conversation to get the new prescription started. I get 4 separate snail mail letters. And each one says, your prescription so-and-so, so-and-so, so-and-so has been canceled. Talk to your doctor. I'm going, if you cancel the new ones, I'm not going to talk to my doctor. And of course, it was the old ones.
Mm-hmm.
Guys, you've got new ones in place. The old ones have clearly expired. Why are you sending me a letter that is difficult to interpret?
Generating billable hours.
No, it's a system that just doesn't know what it's doing. That doesn't understand its job is to figure out what prescriptions you would do and mail them.
Yep.
Right.
Yep. All right. So this has been a lot of fun, and we hope that you guys understand a bit better the benefits of going with either the Hawaii thing, where we're forcing companies that have 10 or more, or that have more than 10 employees. You can have up to 10, but have more than 10 employees. And if you're working at least 20 hours, they're required to provide you health insurance. And just doing that will put us well on our way to people being, significantly more people being insured.
Yeah.
Right now, Hawaii is at over 95% of their, citizens are currently have health insurance.
Wonder how that compares to the great state of Georgia.
Yeah. No, we never should have locked them in. We locked them in with the worst parts of American capitalism and let them just savage them until they're so desperate and so stretched thin. They don't have time to worry about anyone else because they know they're fucked.
I know this is cruel and wrong,
All right.
okay? But my immediate response was, is it too late to build a wall?
True.
So-
On the other hand, right, the Alabama that produced your grandfather, what do you think that human would be like if they were raised in
He would
this
leave Alabama?
Aye, absolutely.
Right. He would walk.
Yes.
Okay.
No, again, I fully endorse people moving the fuck out of the United States.
So yeah.
Was that your last cigarette?
No, I have another pack. So thank you all for hanging out with us. Don't forget to comment, like, subscribe, heart, follow, review us. Tell us what you think. Remember, we're now on, I think it was TuneIn.
Indeed.
We're now on TuneIn. So
I was listening to us on that yesterday.
Oh, seriously? We're up? I didn't bother checking. I probably should have. But anyway, so we're on.
Is there a turn on?
Morning, I might be
Is there a
making
drop
shit up.
out?
TuneIn, I think, is a Google thing.
I don't know.
I don't know.
I was lying.
I just wanted to get the
And
rest
we just
of
want
them
the
on there.
conversation to end.
Turn on, tune in, drop out.
And Musk's brain chips are heading to human trials.
Oh, God.
No, that's good. It lets people with spinal cord injuries work a phone faster than humans with thumbs.
That's cool, though.
So, yeah.
All right.
Or at least let a fish do that. We'll see. What?
The whole idea of a fish with a smartphone kind of worries me.
I want a fucking brain implant. I'm not going to get Gen 1. I want to know what happens if you try and make popcorn with one in your head. I'm going to wait a while, but
Well,
I would absolutely get a chip for the internet.
you know what it'll bring back?
You know how hard it'd be to surgically implant my cell phone?
You know what it'll bring back? Big time? Tinfoil hats.
Oh, yeah.
Oh, God, yeah. So.
you
Yay,
go-
tinfoil hats incoming. Don't forget
Oh,
to
my
get
God.
yours soon. Your
Oh, my
BoomerRexTonight
God.
tinfoil
I have a
hats.
picture of you going
Become
through
a-
a scanner at the airport.
Become
Start singing show tunes.
become a Patreon member, and
Yeah.
we'll get those
Give us your money.
tinfoil hats right out to you. Only our top tier, though. Only our
after we
top
make a new
tiers
top tier.
get the special Boomer Tonight tinfoil hat.
There you go.
God, are we commercialized?
Falwell gave a lame interview.
Again, the whole goal, right, is that airship named Yacht,
Yep.
Fair.
which is really a pirate ship. But who would name a pirate ship Yacht?
That's how they'll never see us
So
coming.
we love you
The
all.
only thing better is the Spanish Inquisition.
We
And
love
that's just for one joke.
We love you all. Have a wonderful night, and we'll see you back here tomorrow night on Boomer Rex Tonight.
And the robes. A fabulous robe would be